Hi, welcome to TalkScript, sponsored by YouPick Health. If you've gotten to this video, you very likely got here by way of our website. So I want to first thank you for visiting. And we're looking forward to engaging with you and hopefully providing engaging content relative to what you do, which is either be a patient of healthcare services, which we all are at some point in our lives, or be a provider of those services. So I want to talk a little bit about UPIC and what our aim in this podcast is going to be, or video cast, whatever you call it when it's on YouTube. Um, so UPIC Health started 14 years ago. We are celebrating our 10-year anniversary this year. But we started because we could see with the advancement of the Affordable Care Act, a lot of chaos that was going to happen in the critical relationship between patients, providers, and payers, insurance payers. Okay. Now, what the Affordable Care Act was intending to do, without calling it out necessarily, was implement what's called the funnel strategy. Okay, something very popular in consumer markets for decades. And that's where my career has been in advancing, maximizing, and optimizing the funnel strategy. So, what do I mean by that? Well, imagine you buy a consumer product or a white good and something goes wrong with it, either something wrong with the installation, something goes wrong with the product. The funnel strategy has held with the advancement of software as a service and our tech industry, really, and AI, which has been around for a lot longer than people realize, is that it's the lowest cost option if you can resolve the majority of those issues online through technology. Okay, and that strategy says the first entry point with a brand in the funnel is online. And if you're doing it right, you've got a lot of data collection around and a lot of analyses and a lot of what's called continuously improving content so that you can keep the majority of that volume online. It's a very low cost option, and it's also good for the consumer. It's quick. You can go online. You can quickly resolve something. But the next tier is typically a call center. And again, we're talking about the consumer markets. The next tier is call center. A little bit more expensive, ironically, but because I'm an advocate, and we'll talk in later episodes about pay equity at the admin level in healthcare. But for right now, for alignment, the next tier is typically a call center where there's a little bit or purportedly a little bit more empowerment, a little bit more training, a little bit more access, and thus a little greater ability to resolve whatever the consumer issue is. Okay. And many companies, banks, have invested a lot in that tier in years past, although there's been some deterioration over the years, to make this as much of a one-stop shop for the rest of that more complex stuff. But then, and remember, we're still dealing with consumer markets. The next tier is getting a field technician out. So they call that rolling a truck. Okay, so you're rolling a truck is the most expensive. You've got travel costs, you've got higher cost technicians who have to go into the home. There's a greater coordination. You've got logistics. You might have to order parts. There's all kinds of stuff that goes on that makes it more costly. So consumer markets have been focusing on the funnel strategy for decades. Well, with the advancement of the Affordable Care Act, healthcare as an industry, without necessarily intentionally doing this, employed a funnel strategy. You've seen a lot of this with online appointment scheduling. A lot of that is to remove some of that access challenge from a more expensive live person. Okay. But consequently, so have the payer markets or the insurance companies. They've also been employing a funnel strategy. Okay. The problem is they've been coming at it from different objectives. Healthcare is using the funnel strategy not only to save money, but also to make money. And the payers have been using the funnel strategy to not only save money, but also save money as it goes through the funnel. And what's happened in the center is very stressed out providers and very stressed out patients, and a lot of cost and ineffectiveness and time and year over year over year, a deterioration of trust in the process. That's where UPIC sits. We sit in that space to help resolve these issues within that funnel strategy to help technology work a little bit better on behalf of the patient and the companies that are employing it, and give the providers more time to spend with patients, helping them get well. That's as simple as I can put it. But there's a lot of complexity, a lot of human emotion, a lot of stress and anxiety, and frankly, there's a whole lot of cost. All of us are, both sides, complaining about burnout, both sides meaning patient and providers. Burnout, the costs are escalating. It's a problem. And the goal of this video cast is to bring in stories from patients, stories from providers, have real conversations, real honest conversations, and not necessarily sell UPIC services. We've got different channels to do that, but hopefully to bring visibility around the human impacts of these deployments in these opposing groups so that we can somehow together effect meaningful change. Because let's be honest, healthcare is cradle to grave, and we all need healthcare providers to be successful. It serves none of us if hospitals are having to close. It serves none of us for there to be chaos in the process of care. So the goal of this podcast is to offer solutions through the lens of those of us who are living in the trenches every day. And we hope that you'll subscribe. And I'm looking for participants now. So we're actively engaging, and got a couple stories that we're getting ready to record and post. Our goal is to have a new story out every 2 weeks. But if you've made it here through our website, then you've given us your email address, and we will be notifying you when a new episode is out. In the meantime, also please subscribe and share with friends and family. And thank you so much for visiting and joining.